Today we will talk about blood pressure. Number 1. Normal blood pressure range. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. It is measured in millimeters of mercury, mmHg, and is recorded as two numbers, systolic pressure and diastolic pressure. The systolic pressure is the first number and represents the pressure when the heart beats and pushes blood out. The diastolic pressure is the second number and represents the pressure when the heart is at rest, between beats. A normal blood pressure reading is usually around 1/128th of a millimeter of mercury. However, it's important to keep in mind that normal blood pressure can vary based on factors such as age, weight, and activity level. High blood pressure, also known as hypertension, is when the pressure in your arteries is consistently too high and can lead to health problems such as heart disease, stroke, and kidney disease. On the other hand, low blood pressure, also known as hypotension, is when the pressure in your arteries is consistently too low and can lead to symptoms such as dizziness, fainting, and fatigue. Number 2. Low blood pressure causes and symptoms. Low blood pressure occurs when the pressure in your arteries is consistently too low. This can cause a reduced flow of blood to your organs and tissues, leading to symptoms such as dizziness, fainting, and fatigue. There are many causes of low blood pressure, including dehydration, certain medications, heart problems, and endocrine disorders. Dehydration, which occurs when your body doesn't have enough fluid, can lead to low blood pressure. This is why it's important to drink enough water every day. Certain medications, such as diuretics, blood pressure medications, and antidepressants, can also cause low blood pressure. If you're taking any medications, be sure to discuss the potential side effects with your healthcare provider. Heart problems, such as heart attack or heart disease, can also lead to low blood pressure. These conditions can weaken the heart and reduce its ability to pump blood effectively. Endocrine disorders, such as diabetes and hypothyroidism, can also cause low blood pressure. These conditions can affect the body's ability to regulate blood pressure. Number 3. High blood pressure causes and symptoms. High blood pressure occurs when the pressure in your arteries is consistently too high. This puts extra strain on your heart and blood vessels and can lead to health problems such as heart disease, stroke, and kidney disease. There are many causes of high blood pressure, including genetics, lifestyle factors, and certain medical conditions. Genetics can play a role in high blood pressure, meaning it can run in families. Lifestyle factors, such as a poor diet, lack of physical activity, and excessive alcohol consumption, can also contribute to high blood pressure. Medical conditions, such as obesity, sleep apnea, and kidney problems, can also cause high blood pressure. It's important to manage these conditions to help reduce your risk of high blood pressure. Most people with high blood pressure have no symptoms, which is why it's often referred to as the silent killer. However, some people may experience symptoms such as headache, dizziness, and shortness of breath. Number 4. Blood pressure and exercise. Exercise is a key component of a healthy lifestyle and can have a significant impact on your blood pressure. Regular physical activity can help lower your blood pressure and reduce your risk of developing high blood pressure. Physical activity can help increase the strength and efficiency of your heart, making it easier for it to pump blood and lower your blood pressure. Exercise can also help you lose weight and reduce stress, both of which are important factors in managing high blood pressure. It's recommended to aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, 5 days a week. This can help lower your blood pressure and improve your overall health. Before starting an exercise program, it's important to talk to your healthcare provider to determine the right type and amount of physical activity for you. This is especially important if you have high blood pressure, heart problems, or other health conditions. Number 5. Diet for high blood pressure. What you eat can have a significant impact on your blood pressure. A healthy diet can help lower your blood pressure and reduce your risk of developing heart disease, stroke, and other health problems. The dietary approaches to stop hypertension, DASH, diet is a dietary pattern that has been shown to lower blood pressure. This diet is rich in fruits, vegetables, whole grains, and low-fat dairy products, and it limits the amount of sodium, saturated fat, and added sugars. In addition to following the DASH diet, it's also important to limit your intake of sodium. High sodium intake can increase blood pressure, so it's recommended to aim for no more than 2,300 milligrams of sodium per day. Other dietary changes that can help lower blood pressure include increasing your potassium intake, reducing your alcohol consumption, and avoiding processed and high-fat foods. Number 6. Blood pressure medications. If lifestyle changes, such as exercise and diet, aren't enough to manage your high blood pressure, medications may be necessary. There are many different types of blood pressure medications, each with its own unique benefits and potential side effects. Some common types of blood pressure medications include diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. It's important to work with your healthcare provider to determine the right medication and dosage for you. This will depend on your individual needs, such as other health conditions you may have and any potential drug interactions. In addition to taking your medications as prescribed, it's important to continue making lifestyle changes to help manage your high blood pressure. This includes regular physical activity, a healthy diet, and stress management. Number 7. Blood pressure monitoring at home. Monitoring your blood pressure at home can provide important information about your overall health and help you manage your blood pressure more effectively. Regular blood pressure monitoring can help you and your healthcare provider determine if your treatment plan is working, and if any changes are necessary. There are many different types of home blood pressure monitors, including manual and automatic devices. It's important to choose a device that is accurate and easy for you to use. When monitoring your blood pressure at home, it's important to follow the instructions provided by the manufacturer, as well as any instructions from your healthcare provider. It's also important to take your blood pressure at the same time each day, and to take multiple readings to ensure accuracy. In addition to monitoring your blood pressure at home, it's important to attend regular checkups with your healthcare provider to ensure your blood pressure is under control and that you are managing any other health conditions.